The goal of personal medical case management is to guarantee optimal medical outcomes for the patient. This goal is achieved by assigning a dedicated team that accompanies and advises the patient throughout their medical journey. There are 5 main stages to this journey. First, the medical intake stage, in which the case management nurse and doctor review current complaints as well as personal and familial medical history, all to gain a complete and comprehensive view of the patient's medical history. Second, the case management team reviews the case, the imaging tests, lab tests, and other diagnostic information. This information is sent for consultation by a global network of specialists to gain expert opinions regarding the patient's case. Where a layman would not know what to ask, whom to ask, and what to make of the answers, the case doctor's job is to consult with the relevant specialists, challenge them, and question them. Throughout this stage, additional tests may be recommended according to medical standards. In the third stage, once the consultations have been made, the case management doctor will summarize the expert diagnosis, discuss and explain it to the patient. According to our past experience, in 20% of the thousands of cases we have managed, the original diagnosis provided to the patient by their treating doctor has been changed once the personal medical case management specialists became involved. In the fourth stage, the case management doctor will then recommend the optimal treatment and the leading treating specialist for the particular disease. Here too, we have found that in over 40% of the cases we have recommended a different course of treatment and prevented unnecessary medical procedures in 55% of cases. Counter to common belief, sometimes the best doctors are to be found in public hospitals, where thousands of patients are treated every year, especially in those hospitals that are associated with education and research institutions. And finally, the personal medical case management team maintains contact with the patient during and after the treatment to make sure that there are no adverse effects from the treatment, nor any relapse for a minimum period of 3 months.